Hello everyone, welcome to sqadia.com. I'm Dr. Hina Khan, and today the topic of our lecture is the autoimmune disorders that manifest themselves as the neuropsychiatric complications. So basically what happens, or what is the underlying pathology behind the autoimmune disorders, is that the body itself is making the antibody against its own cells. When we say the neuropsychiatric complications, it means that the antibodies are building up against the neuronal cells of the bodies. So that is what we're going to discuss over here in this lecture. Now, there is a list of disorders that we can include under this heading, that is basically the autoimmune disorders manifesting as the neuropsychiatric complications, which includes the multiple sclerosis, of course, on one hand. Then we have the Huntington's disease, Wilson's disease, we have the Parkinsonian disorder, which is very common, and it also manifests as the neuronal complications. So first of all, in the very first section, we'll be discussing the definition of multiple sclerosis. How do you basically go about and define this condition is again very important. It's again the autoimmune bodies that are building up against the central nervous system over here in this disease. Then the causative factors and the risk factors which make the person more prone to the development of the multiple sclerosis, that will also be discussed over here in this very first section. Then we'll move on to the clinical presentation, the symptomatology of multiple sclerosis, which is again very important for the final diagnosis, and then the treatment modalities are built up accordingly after the diagnosis is made. In the second section, we'll move on to the complications of multiple sclerosis. So again, the manifestations, the neuropsychiatric manifestations will be discussed over here. The suicidal intentions, what is the prevalence and the occurrence rates of the suicidal intentions or the suicidal rates in people who are suffering from multiple sclerosis. Then the rates of depression that are diagnosed and that are associated with the disease of multiple sclerosis. Then the emotional lability. People, of course, they become quite aggressive. They are emotionally unstable when they are suffering with multiple sclerosis. What are the reasons behind this? That will be discussed over here in this very second section. In the third section, we'll move on to the cognitive deficits over here. So people who are suffering from these autoimmune disorders, they also suffer from the cognitive disabilities that can range from delirium, dementia, loss of memories. Huntington's disease will be discussed over here. Then we'll discuss the definition, of course, first of all. Then we'll move on to the progression of this disease and the symptomatology or the clinical presentation of Huntington's disease, abbreviated as HD. Then it's also known as Huntington's chorea. In the fourth section, we'll move on into this Huntington's disease. We'll be discussing the onset of this disease particularly, then the clinical presentation, and then finally we'll discuss the treatment modalities that are quite peculiar to this Huntington's chorea or Huntington's disease. In the fifth and the final section, we'll be discussing Wilson's disease, which is basically again an autoimmune disorder, and that is characterized by the deposition of excessive copper in the peripheral body parts. It can be the eyes, it can be the pupils. We have the Kayser-Fleischer rings phenomena that is quite commonly seen when the copper deposits are found in the pupillary region. And then first of all, the examination, again, the physical examination is very important when we are discussing the Wilson's disease. So we'll go through that briefly in this very final section, and then we'll move on to the background of this Wilson's disease. And finally, we'll be discussing the clinical presentation of Wilson's disease, focusing particularly on the neuropsychiatric complications that we can observe in a person who is suffering or who's diagnosed with Wilson's disease. So I hope you want to learn more about these autoimmune disorders which can manifest as neuropsychiatric complications. So do watch the other sections to this lecture as well.